Hello everyone, here we are in Chapter 10, Part 5. And here, so we've already talked about the PPACA, so now let's get into different kinds of health insurance and what those look like. So what I would ask you to do is to start on what in my book is page 250, and there's a figure 10-2, and I think it does a really nice job. It's a flow chart, and it tells you about indemnity plans and prepaid plans and where the health maintenance organization falls in and the preferred provider organization. So indemnity plans, it's kind of the opposite of the prepaid. So prepaid plan says we have X number of employees and we are going to pay this amount per employee for services. So our employees may use less, they may use more, but this is what we're paying, okay? And then the indemnity plan is more that we're going to pay as services are rendered. So an employee goes to the doctor and then we're going to reimburse that employee for the cost of it. So which is a health maintenance organization. So if you go to figure 10-2 and you'll see it branches out. And over on the left hand side is the prepaid, and there you can see that those are HMOs, health maintenance organizations. If you go to the right branch and go all the way to the bottom, that's where you're going to see the preferred provider organization, and that is an indemnity plan. So what is a network? So in these types of plans, you can have an in-network and an out-of-network. If you go in-network, your costs will be less because the PPO or HMO has negotiated and contracted with these preferred providers, and that can be, hospitals, doctors, pharmacists, and there is a certain amount that they will pay per service. So we know how much it's going to cost to get an office visit and an injection. But if you go out of network to any doctor, then they can charge a fee that may be higher than that negotiated rate. You're going to have to, as the employee, you're going to have to actually pay more for that because it is out of network, okay? So which type of plan doesn't have a network? So again, if you go down that branch, you can see that on the indemnity side, the traditional fee for service plans, and that's a very traditional service. All right, now I'm not going to talk to you too much about fee for service, HMO, PPO, EPO, POS, carve-out plans, all these things on the screen here. I'm going to expect you to know, but they're really just definitions, and so I'm going to ask you to look at those yourself. So let's talk about some comp in the news here. We've got Walmart is testing pilot programs to help employees with health care. Because again, health care is expensive. It's expensive for the employer and it's expensive for the employees. So Walmart, who employs a lot of people, hundreds of thousands of people, is just trying to figure out different ways that they might be able to help manage those costs for all parties. So starting in January of 2020, one of the things that they're looking at is increased telehealth services. So calling up that nurse and telling the symptoms and seeing if you need to go to a doctor or not, and if they might be able to help you over the phone. Also, helping employees find healthcare providers, because a lot of people, you just ask your friend, where do you go to the doctor? Or you might check on social media. We're really not very good at the individual level of managing our own healthcare. So that's something that they want to help with. And they're also looking at nationwide offering, fitness club memberships, health plan features $35 copay. So again, just trying to help people be healthier and to manage that. And a survey went out from Willis Towers Watson, and they're looking at this values-based approaches, okay? And they're seeing that more employers are going in this direction. And what they see here is that they're trying to push their employees more to those high-performance networks. So we're doing lots of data gathering. We're looking to see which networks are actually high performers who have good outcomes. And then your employees can choose among those. Also using highly rated standards of excellence. So again, don't go to the local place. You're going to go to MD Anderson. You're going to go to Mayo for these specialized services. We are pushing people more towards services that produce positive health outcomes at a lower price tag. Where do you get the most bang for your buck? And we're gonna let the employee pay more if they insist on having services that, again, the data show are overused and are often unnecessary services. And this is something that's fairly new as well, is that the companies are actually doing what they call medical tourism, right? So companies are paying for employees to travel for cheaper health care. And again, you can see here, Amazon will pay employees with cancer to travel to City of Hope in Los Angeles. And this is a growing trend. It's less expensive for us to make sure that our employees are getting the very best care and getting it taken care of in the long run. All right, so this is in our book, and our book calls it the consumer-driven healthcare. And these are different ways of kind of having a savings account for your healthcare dollars as an employee. The first one, I'm going to start on the right. The first one that I'm going to talk about is the flexible spending account. That is very, very common, okay? And it is, as you can see here, it's employer owned. And although it says that employers or both can contribute, it's generally the employee that puts in money. It's pre-tax dollars that you're putting in. Now, the thing with the flexible spending account is you've got to be a really good estimator. You need to make sure you know about how much money you spend in a year on healthcare. And these have to be, as you can see, there's an asterisk, qualified expenses. So you check out what your qualified expenses are that are in addition to your healthcare premiums, and then you calculate, because at the end of the year, this is not a rollover, at the end of the year, if you haven't spent everything that's in your flexible spending account, it goes away, unless your organization chooses that you can roll over a little bit, but they have to declare that up front. And I'm trying to remember, I think it's like $500. But why is it great? It's for the employee. It's great because, again, it's pre-tax dollars. And if I go to the hospital in January and have some sort of a procedure, I can take out all the money in January, even though I'm paying through my paycheck incrementally throughout the year. So I may have only put in, a couple $100, but I can take out all of the money that I have said that I want to put into my flexible spending account. All right, so let's move now to the health reimbursement arrangement or health reimbursement account. And this is one where it is, again, employer owned, but the employer is the one who is contributing to that health reimbursement account. So the good things here is that, again, the employer contributes to it, and it's not part of the taxable wages. It's also that unused money can roll over, but the employer decides how much of that money can roll over. Why is it great for the employer? Well, again, for the employer now, this money is tax deductible, and they can choose those qualified medical expenses. All right, now we're going to move to the third one, which is the health savings account. This one the employee owns, okay? So it is a savings account. It's really an employee savings account that they can use for healthcare, medical expenses. All right, it says who can contribute. Again, generally the employee is the one that contributes to that, but they can certainly both contribute. The advantages to the employee, again, pre-tax dollars, always awesome. Unused money does roll over. This is a savings account. It belongs to the employee. So certainly that money rolls over. It can also be invested. It can, if you quit your job or leave your job for whatever reason, you take that money with you. It belongs to you, okay? Now, what is a high deductible health plan? And what does it have to do with this page? So we talked about this, I think, in part 4, which is the high deductible plan. So instead of, a lot of companies have both a traditional plan as well as these high deductible plans. So it's, again, if you're young and healthy, it might make more sense for you to go into a high deductible plan because you don't go that often. And that is tied to this health savings account. Okay, so you can use what's in your health savings account to go to the doctor because it's such a high deductible. Generally, anytime you go to the doctor, you're going to have to pay for it out of your own pocket. But remember, you're also paying lower premiums. Okay? Now, a new law allows employers to pay cash for health insurance. This is one of those things people don't know how it's going to go. It could take off, or very few employers could use it. But it's interesting because like small employers in particular who don't have group health insurance for their employees can start putting money into that health reimbursement account, and instead of paying for health insurance directly, paying a health insurer like Blue Cross Blue Shield, they're putting money into the employee's health reimbursement account, and then the employee can go out, find their own health insurance on the health insurance, like a ACA exchange or some other way. So I don't know, this is brand new, January 2020, but it's an option. Okay, so COBRA, Consolidated Omnibus Budget Reconciliation Act. What COBRA has been around since 1985, and it was designed so that if somebody left a job and had some sort of illness, or one of their family members had a chronic illness, when they go to the next job, they're going to be able to maintain their coverage. They can, while they're unemployed, they can continue to pay that group health insurance that they had with their employer. Now, the employer can also add on an additional 2%. But as you guys saw, there's an employer, portion that they pay, and then there's the employee portion that the employee pays. Well, the employer portion tends to be quite a bit more. Now you're unemployed, you're paying the whole thing, total premium. So that's tough. So how do you know if you should go PPACA or COBRA? You just got to run the numbers. You need to see how much does it cost to get COBRA from your former employer, or how much is it on the PPACA, on that ACA exchange. And you might get a tax subsidy, especially if you're unemployed, right? You might get that tax subsidy, and so you can get some of that. You might be able to get your health insurance for a lot less money, but you just need to run the numbers. So why do employers care about HIPAA? Now, HIPAA is the Health Insurance Portability and Accountability Act. And portability, accountability, privacy. So portability, again, is where you need to make sure that as employees move from place to place, right, that they, those group health plans will guarantee coverage in the subsequent employer's health plan. That's pretty common, so that's really not such a big deal. But privacy, you get a lot of information on your employees and the health care that they're getting. You need to be really careful with that data. Finally, what are some of the benefits of benefits? Primarily, the legally required benefits, again, are just to make sure that people can continue to have that subsistence income, that they're going to be taken care of when something really bad happens. Now, negatives, of course, it's expensive. It can be a hindrance to companies. But how can they reduce these costs? Unemployment insurance. Figure out why you might have layoffs and try and prevent that. Workers' compensation. Figure out, why are people having accidents? What's going on? Take care of that. There are many ways. You got to look at what you're spending and then take care of it. All right, guys, I think we have wrapped up Chapter 10. Thanks so much.